with a virtual presentation. And then March 10th in Port Hadlock, March 17th in downtown Port Townsend, and then the 24th in Quilcene, and the 25th in Ludlow. So we are going to be on the road and meeting with our peeps out in every corner of our district. So you are welcome to attend those. And we'll see how well they are attended. Next slide. So just a couple of other updates and events. The first is that we continue to work on identifying regional alliance opportunities. And what I mean by that is we have a very strong interest and very strong belief in independent, locally governed healthcare is the best model. Kind of this local healthcare is better healthcare. And with everything going on in healthcare these days, and some of the pressures that organizations are feeling, that we are stepping into, are there models that independent, locally owned and governed organizations can align and work together to benefit from, size and scale with respect to purchasing supplies, purchasing drugs, purchasing medical malpractice insurance, all of the stuff that we buy that is absolutely volume sensitive, and other advantages of largesse. Are there models in which two smaller organizations can benefit from that to give them a competitive advantage while maintaining complete local control and autonomy? And we've spoken a little bit about some of those opportunities, but that I think that we continue to be really interested in that, and it wouldn't surprise me if that's something that we will continue to manage. And then lastly, there's again a lot of activity from Washington D.C. and what is next up. It's about $1 trillion reduction to Medicaid, and where it being proposed, and where we are seeing that is in, as I mentioned, the reduction in federal support of Medicaid expansion, which will just lop people off the rolls, because you go from a situation of being eligible on one day and not eligible for Medicaid on the next. And then also administrative hurdles. And these are things that on the surface seem reasonable and good practice, and maybe they are, but the net result is people lose access to Medicaid. And one example of that is a work requirement. And while on the face, most people who receive Medicaid do work, and that may not be an unreasonable expectation. However, the unreasonable part is how that information is shared on, and demonstrated and proven on a regular basis. So where that requirement has been placed in the past, the net result is people falling off the Medicaid rolls because of just the bureaucracy and the administration related to the 90-day requirement that you send in W-2s or some sort of pay stubs or some sort of demonstration that you are indeed working. Another example is the requirement to re-up every 90 days. So that's a step that will, frankly, with my insurance, if I was required to re-up every 90 days, I would be certain that there would be periods that I would miss, and if there was a real heavy hand saying, "Up, you're a day late, no insurance for you," that I would find myself in that situation. So that some of the hurdles that are being contemplated carry with them a significant positive fiscal note. So I think the motivation might be equally, let's create more accountability around Medicaid, and let's save a lot of money, because we know that creating that accountability will result in fewer people needing care. And what we have learned over and over again is that whether you have insurance or not, you still need healthcare. And more so that if you don't have access to regular primary care visits and wellness visits and preventive healthcare visits, that you will likely end up in the emergency department dealing with which is a very expensive place to seek care, and tragically dealing with something that is far more advanced than it may have or would have been had you been able to access a doctor earlier on. So that's a commentary of all this at the end of the day, I'm not sure we will be saving much money, just spending it differently. So that's coming. And that for an organization that it has a value of taking care of our community and not letting ability to pay for care get in the way, that's of concern. Tyler and I were going over our charity care and bad debt. We're just south of $10 million now if you add both of those categories. And that's there is no question in my mind that if Medicaid gets squeezed, that number will grow up. We are, as an SLG team, we are beginning to contemplate the possible implications of that and try to get out in front of it. So Mari, see your hand up.
You just answered my question. Thank you.
Oh.
Regarding anticipated increase in charity care or uncompensated. Yep. Thanks.
Looks like Matt has a question.
Yeah. It's about the regional alliance opportunities. I feel like there was a lot of discussion about regional alliance opportunities over email, and in the executive session at the last meeting that I don't think are covered by executive session. And I know you guys are all aware of this, and there's a lot to discuss here. I sent you all a document about the regional alliance opportunities that are actively under exploration, and I need to know, are you guys considering that topic covered by executive session and not something we can talk about with the public?
Yeah, Matt, I think I responded to your question that executive session, that the issues we were talking with the board about related to the possible acquisition or transfer or lease of assets. That was part of the proposal that we were reviewing. And as you and the rest of the board are aware, that is discussions about possible leases or transfers of assets or acquisitions of real estate for reasons that make perfect sense to me are covered under executive session. I thought that I answered that pretty clearly to you in your email.
Yes, Mike and I discussed before we held the executive session whether or not that was a topic that could come under that, and we looked at the RCWs and decided that that was something that did, because we were considering the possibility of leasing some property, and that is one of the, as it turned out, we didn't get that far when we talked about it because our time ran out, but we did briefly discuss it. So I read the letter that you sent to the commissioners, and it only came about 2 hours before the meeting started, so I haven't really had a chance to digest it. And it was sent to all the commissioners, so we couldn't respond because we didn't want to have a serial meeting. So I think that we were perfectly within the law for doing what we did.
Well, regardless, I need to know if the topic of, if we're going to discuss major governance changes, major partnerships or alliances with other institutions, that topic is not covered by executive session. Just that it tangentially might involve a real estate transaction at some point is, I think, really stretching the real estate cover for executive session. But in any case, if we're talking about major partnerships or alliances actively, I would like to know when we can discuss this publicly, and including the email that I sent all of you. If you don't want to discuss that here, I would like to discuss it with people that care about healthcare in our community so that we have an informed public. And I was under the impression today is the deadline for some possible response about something. And so are we allowed to talk about potential alliances that we're exploring or working on in any way?
So there's a couple other questions. Case, do you have a question? Or a comment?
Yeah. First of all, I also share the question of whether or not that is the best way to handle this kind of situation. I did happen to check with MRSC, and they sent me some resources, and I'm happy to send that around to people. Again, don't reply to me. They sent it to me. Obviously, MRSC never gives legal advice. They just point you in a particular direction as to where you might be able to find your answers. But I think it would be important for us to have that as a topic on our next agenda, so that we can, make sure that we are following the law. Anyway, so that's just my recommendation.
Yes, I see nothing wrong with that. I think that would be a very good idea. So we can talk about that at the next meeting. We should know more by then too. So.
Yeah, Matt, there's really nothing to talk about right now.
Really?
Right. That if additional discussions regarding regional alliance opportunities emerge, then yes, those discussions would be held in appropriate venues and forums. Okay.
Sure.
All right. Okay, so
I'm still unclear if the topic is something that, you know, I'm legally obligated not to talk about because it was talked about in executive session, even though there's been emails that, you know, exchanged about the potential alliance opportunities we're exploring. It's really unclear if that's somehow covered by executive session and it's restricting the commissioners from discussing it with other people.
Well, I think that's, I can't answer that. I'm not an attorney.
Bruce, you have something? You have Congress? Yep, you're muted.
Did I see, Bruce, did you have your hand up?
Yeah, I did. So my thinking is that a lot of what we talked about in the executive session, we didn't need to be there. I mean, in my mind, Mike could have had conversations about this. I mean, this is all just speculation. There's nothing, it was a conversation and there's nothing really to talk about because we talked about some possibilities, but until there's other conversations that go on and it comes and we decide whether we're going to do something or not, there's no vote on it. So I don't know. I mean, Matt, I don't know what you'd have to really talk about because there's nothing definitive to talk about. No decision's been made on anything.
So I think we should just continue this to the next meeting. And I can't answer your question, Matt. I'm not, like I said, I'm not an attorney, but there isn't really anything that you would say to someone would be just conjecture, or, you know, there wouldn't be anything concrete. Does that answer your question as much as possible?
Not really. I feel like we're in a weird, I mean, a pretty concrete proposal was drafted. I mean, it's a preliminary proposal, but it's, and that was shared with the commissioners in email, but we haven't talked about it with the public. I think it'd be good to talk about it with the public, you know, even if it doesn't get approved, it's like the public should know that we considered a proposal like that. But anyways, we can save it for a future discussion. I'm fine moving on now.
Okay, then we will continue this at the next meeting.
Yeah, I think this is a common sense thing to do, is just look at it later on when there's something maybe to look at, because right now it's airy-fairy and of no consequence.
Yeah, I will prepare a detailed response for the next time we talk about this, because I would very much like to respond to Commissioner Reddy's comments. So I look forward to the next time that we talk to this.
Okay, we will put it at the top of the list for the next meeting. And at this point, are there any other questions of Mike? Mike, were you at the question part of your presentation?
I think I'm done, Jill.
Okay, then if we have Dr. Butterfield